Okay, welcome back. I'm pleased to introduce Deanna Boughton. Deanna works in the executive office as the county health benefits technician. She has been with the county for 18 years and spending 13 of those years in health benefits. Her responsibilities include the update and maintenance of eligibility for the county staff and their dependents. The county currently covers 1,700 or over 1,700 employees and family members on our plan. Deanna handles the day-to-day customer service aspects of the county health benefits, responding to email, phone calls, and instant messages throughout the day. Her goal is to make sure that county employees know how to use their benefits and take advantage of the help available to them to make sure they are at their best. So Deanna, thank you very much for being with us today, and we'll turn it over to you.
Thank you. So most of us know that there is no health benefit that carries over into retirement. The option that we have available is a program called COBRA. The Department of Labor defines that as the Consolidated Omnibus Budget Reconciliation Act, and it gives workers and their families who lose health benefits the right to choose to continue group health benefits provided by their group health plan for limited periods of time under certain circumstances, such as voluntary or involuntary job loss, the reduction in hours worked, transition between jobs, death, divorce, or other life events. So most people don't quite understand how the process works. It's very seamless. When you leave county employment, we receive notification from the payroll team that says that you have left county employment, and then we notify Anthem Blue Cross that you have left county employment, and they put together a letter that is sent to you offering you COBRA benefits. It's actually through BCC at this point, which is our administration team. So what BCC does, and let me go ahead and share my screen here. That would probably help. There, how's that?
There we go.
Okay, so when you lose health coverage because you leave the county employment, you can choose to enroll in up to 18 months of continuous coverage from your current health plan. It includes your medical, dental, vision, and pharmacy benefits. We don't require that you restart your annual deductible or your out-of-pocket maximum. So it literally is just, it's a continuation of the benefits that you currently have. As I was saying, the enrollment process is very easy. You receive the enrollment opportunity by mail, and you have 60 days from the date of the letter that they send you to enroll, and your coverage is backdated to the last date that you had coverage as an active employee. The cost is something that some folks go into shock over, because instead of you paying 25% of the premium as a no longer active employee, you would then pick up 100% of the health premium plus a 2% administration fee. So currently, if you were enrolled in Plan 2 for employee only, the current cost to you as an active employee would be $90.35 per pay period. It would become $435.56 per pay period, or roughly $900 and some dollars for the month. So for some folks, that can be a deterrent, but if you were to go to another source and try and find the same benefit plan, you would find that it's very competitive in the marketplace as far as the benefit. For a $500 deductible with an out-of-pocket max of $4,000. So most folks use this when they leave employment as the bridging program to get them to Medicare or their other final health benefit program. And at this point, I'll go ahead and open it up to questions.
It doesn't look like we have many questions right now.
Well, it's a fairly cut and dried program. It's a federally offered program we're mandated to have. So
Looks like Doris maybe had a question or something to add.
Deanna, I was just curious, is there anything else we should know about leaving county employment other than the information on COBRA?
As far as health benefits, no. What I typically advise folks to do is to contact retirement, make sure that their information is updated prior to leaving. Other than that, that's typically the only thing that we do here is just advise that they make sure to stay in contact with address changes and whatnot.
Thanks.
All right, now it looks like we got the questions. Do I have a requirement to prove I have medical insurance to the county when I retire? I'm on my wife's insurance.
When you retire, the health plan does not require that you provide proof of having coverage once you are no longer an active employee.
And does the COBRA bridge preclude other concurrent coverage?
That's a good question. As far as who would be primary, who would be secondary, I believe COBRA would come in as a secondary because it is a bridging program. It's not intended to be a long-term benefit.
And another anonymous attendee asks, if I have my spouse on my insurance when I retire, can he also get COBRA coverage?
Great question. Yes, absolutely. COBRA is offered to employees and their family members who leave employment or lose coverage for some other reason.
And another anonymous attendee, just to clarify, the benefits would be exactly the same as an active employee?
Yes, your medical, dental, vision, and pharmacy benefits would remain the same. So if you are in Plan 2, you would be able to enroll in Plan 2. You do have the ability to, because each person is offered COBRA, you can change from employee, spouse, and child coverage to just employee coverage. Those are pretty much the only changes that you can make. The program itself is the same. So if you're in Plan 2, you have Plan 2 COBRA, and that's going to be the same $500 deductible, which you do not have to start over. So if you retire in June and you've already met your annual deductible when you leave, you don't start over with a new $500 deductible under COBRA. It just continues.
We have a question from Candy. Does county health insurance end on your last day of employment or like your last day worked or the end of the pay period in which you retire?
Good question. Currently, the health benefits end on the last day of the pay period that you last work in. However, with our new administration, we are finding that there may be coverage to the end of the month. If you have questions on that individually, we are researching that with them. So it may be that you have coverage for your health benefits to the end of the month, but we are getting clarification on that as we speak. The question has been posed to them. We're just waiting for a response. Good question.
Colleen asks, would it be possible to have Medicare Part B and a supplemental plan activated before the separation date? And I'm not sure if this is something we want to wait for the Medicare presentation for, or...
As far as the health plan goes, we have employees who are covered under Part B and have the county's health plan. The supplements is where it gets a little bit sticky because you cannot have a pharmacy benefit and the county's pharmacy benefit under Medicare. So individually, we do have folks who are covered under Plan Part B and our health plan. Our health plan would be primary and their Medicare would then be the secondary coverage.
Okay, and we have another anonymous attendee asking, at what point should one apply for Medicare when they're already 65 or above? And I'm not sure if that's another high cap one that we should wait for.
The way that health benefits looks at that, that's a personal decision based on your medical needs. We don't make any recommendation as to whether you should apply for Medicare Part B. Part A is a requirement once you turn 65, I believe, and that is a no-cost hospitalization plan. And we work with all of our employees who have that. We coordinate benefits with that. So as far as making a recommendation as to when you should apply for Part B, that's going to be an individual decision. All right. Well, thank you all for your time. Please feel free to reach out to me directly if you have questions. My number is 707-234-6604.